Good evening, everyone, and welcome to today's live session on look at a root canal treatment. And on tonight's discussion, we'll try to keep it as simple as possible. We'll try not to use a lot of medical jargon, which means that feel free to ask questions and also let me know if there is anything that you are unable to understand. I use a very medical, a very strong medical language. You let me know so that at least we are interacting in that manner. Okay, so for tonight's discussion, we'll focus our attention on, to begin with, we need to understand what a root canal treatment is. And then we should also understand why you might need a root canal. Then what are some of the signs and symptoms that you shouldn't ignore? Then I receive this question from most of my clients, my patients, to say, is a root canal painful? We'll answer all those things. What happens during the root canal treatment? And also root canal versus extraction, because now we are supposed to try to understand the pros and cons for both the root canal treatment and the extraction. Then we'll also address some common myths that we usually receive on the root canal treatment. Okay, so to begin with, let's understand what a root canal treatment is. So when we look at the structure of a tooth, there is a part that is called the enamel, which is the white part that we see. Then there is a dentine, which is the next layer after the enamel. Then from there is what is known as the pulp. So now, the pulp is an important area that we'll focus our attention on in this discussion, because that's our main interest when it comes to the discussion of a root canal. So the root canal treatment that we are talking about is simply dealing with the pulp, which is the living part of the tooth. So this pulp has the nerves and the blood vessels. So that will be our main area of focus. So there is the pulp. That pulp now goes deep into the roots of the tooth. So the roots, that's where the canals are. So that's why when we are talking about root canal treatment, it means that we are treating the root canals, which means that the living part of the tooth and also going deep into the roots of the tooth. So now, this pulp that we have looked at, it contains nerves and blood vessels, and it's the living part of the tooth. Then also, this may be affected by, let's say, dental decay, cracks due to trauma, or it may result in inflammation. So root canal treatment in simple terms removes the infected or inflamed tissue, cleans the canal system, and eventually seals the tooth. So one thing that should be understood here is that we remove the infection from the tooth and not the tooth itself, because most people confuse root canal treatment with extraction. So when we are talking about root canal treatment, we will remove the infection from the tooth and we won't remove the tooth. Remember, when we talk about removing the tooth, that's a different treatment modality, which is now extraction. So now, what are some of the warning signs that you should not ignore? To begin with, when there is severe or persistent toothache, when someone has pain that keeps coming back randomly during the day, the kind of pain that does not go away on its own, the kind of pain that only responds for a few minutes to the painkiller and then it comes back. Such kinds of toothache should not be ignored. Then prolonged sensitivity to hot or cold food. This means that under normal circumstances, we are supposed to enjoy the food that we eat, whether it's hot, cold, or lukewarm, depending on what we are able to enjoy. So we should not ignore prolonged sensitivity. You take something, there is some sensitivity that may linger for quite some time. That is not normal. So such kinds should not be ignored. Then pain when biting or chewing. Every time you bite in something, there should be no pain. This means that under normal circumstances, our teeth are not supposed to pain every time we bite something, because that is a sign that there is a problem somewhere. Then swelling around the gum or jaw. You open the mouth, you see that there is a pimple that looks suspicious, or there is a swelling around the tooth that looks suspicious. These are some of the things that we should not ignore, because such kinds of things will give you a sign that there is something that is wrong. And in most cases, people expect to have pain when they see these things in the mouth. It doesn't always present with pain. This means that every time we see something that looks suspicious, we shouldn't always expect to have some pain, because pain in most cases may even come when it's too late. Okay, then we can also talk about a broken or badly decayed tooth. You see a broken or badly decayed tooth in the mouth, and it doesn't produce any pain like I earlier mentioned. You shouldn't ignore such, because even if a tooth doesn't produce pain, provided it's badly decayed, it means that it can easily harbor bacteria, and also it can trap food particles. And also when a tooth is badly broken, you will find that such kinds of teeth are non-living. And also the body has tried by all means to try and deal with such kinds of teeth. You will find that they have gone into what is known as the chronic phase. So they do not even produce pain. Okay, for those that have just joined us, we are discussing root canal treatment and what is expected from it, when do you need root canal, and also other things like that. So one thing that I would like to emphasize is that no pain does not necessarily mean that there is no problem. Remember, pain may come when it's even too late. So an infected tooth can sometimes stop hurting like I earlier mentioned. This means that the body finds a way to deal with such kinds of infection. They go into a chronic phase. So the nerve may also have died while the infection remains around the root. And when the tooth dies, it may no longer produce pain, but the infection will still be inside the tooth. And also pain alone cannot tell you whether a tooth is healthy. A proper dental examination when needed, and an X-ray is indicated in such cases, because when we look at an X-ray, it will tell us whether the infection is just limited to the pulp, or it has reached the root canals, or it has reached what is known as the apex of the tooth, which is the part where the root enters the tooth. Okay, why does the pulp become infected? So to begin with, we should understand that the pulp, being the living part of the tooth, is more vulnerable to such kinds of infection. So if there is a breach to the protection around the tooth, which eventually results in the pulp getting infected, you will find that the infection will continue build up. So untreated tooth decay may result in the pulp getting infected. Cracks in the tooth. Let's say you are trying to open something using your teeth, as we usually discourage to use teeth for opening things like bottles, depending on the type of bottles that we are discussing. So we discourage people from opening things with the mouth, because we don't use teeth as instruments. This means that every time you open something hard with the teeth will take that as trauma. And in some cases, there may be minor cracks that cannot be seen clinically. So these kinds of minor trauma may create breaches in the enamel and dentine, which eventually allows the infection to reach the pulp. Severe trauma to the teeth or the face may result in the infection of what? Pulp. Repeated dental procedures in some cases, depending on what procedures we are dealing with. These may also result in infection of the pulp. Leakage around an existing restoration. Let's say there is a filling that was not done properly. The infection continues to seep around that infection. It continues to build, because when we do these fillings, we're supposed to make sure that we seal it nicely in such a way that there are no minor leakages around the filling. Okay, so Now that we've understood how does a pulp get infected, we can now also discuss the question that I usually receive from my patients to say, is root canal painful? So now, and I give a very simple question to this answer. The simple question is, when we look at root canal treatment, it is more on the cosmetic side of treatment, which means that it can be less traumatic than an extraction, which means that the simple answer is a root canal is not supposed to be painful and it's not supposed to be traumatic, because remember, we are taking a more conservative route. Okay, we have a question here from Mr. Chadi Chikashi. The question is, can you just repeat what infects the pulp? Okay, so there are a number of things that can result in infection of the pulp. Thank you very much for this question. So to begin with, the most common cause of infection to the pulp is dental caries, because remember, those caries will is a collection of bacteria. So dental caries will eventually result in the infection of the pulp. Then some other causes of infection of the pulp may be minor cracks on the tooth structure. Let's say there is minor trauma to the tooth, there is a crack that you can't see with your naked eye. That may also result in infection that may eventually reach the pulp. Then also repeated dental procedures. The filling is done, it's redone again. You find that eventually the tooth becomes weak and it results in what? Infection of the pulp. Then also leakages around existing restorations and in this case feedings. These may also result in the infection of the pulp. Then also there may be people that may be suffering from other infections. These infections may not be treated and may not be related to the teeth, but they may eventually reach the tooth structure. Let's say someone has the infection in the nose or the eye, and this infection is taking a local spread. It may result in what? In infection of the teeth and eventually the pulp. Okay, so I was explaining on whether root canal treatment is painful or not, and the simple answer is a root canal is more on the cosmetic side of the spectrum, and it is not supposed to be painful, it's not supposed to be traumatic. So usually when we are doing these procedures, because we have to reach the nerve, which is the living part, we have to give local anesthesia. So now, for those that do not know what local anesthesia is, it is simply a numbing medicine that we first spray. We start with a spray for us. We start with a spray. It numbs that area where the injection will come. That is where it reduces the impact of the needle. Because remember, if we just go directly to a needle, for those that are doing these things for the first time, they may it may be a traumatic experience for them. But for the veterans, we ask you, have you ever done any dental procedures? Yes. Have you been injected in the mouth? Yes. Then for those, we don't even need to use the spray, because those are veterans. They've done this a number of times. But for those first timers, we'll first start with the spray. We put some topical anesthesia, which is the spray or the gel. It numbs the area around where we want to do the injection. And then after that, now we give the injection or the jab. So after 2 to 5 minutes, the area will become numb. And then after that, it is not painful. It's not supposed to be painful, because even before we start the root canal treatment, we are supposed to ask you, how are you feeling? Is it still the same? And after you answer yes or no, we'll still test and check whether there is pain or not before we start the treatment. Okay, so for those that have just joined us, we are discussing root canal treatment, and feel free to ask questions, feel free to share this with other people so that they may also benefit from the information that we will share. You can also tell us where you are watching us from in the comment section so that at least we know that you are part and parcel of us. Okay, so the thing is that after we give that injection, there is that numbness that comes. And after that, pain has been taken away. But there may be some pressure. Pressure is basically a sense of touch. So you find that you may be able to feel that pinch, but there is no There is no pain. Okay, so now but the goal is to keep you as comfortable as possible, because remember, when we are doing these dental procedures, in most cases, most patients don't want to come to the clinic. So we try by all means to make sure that we keep you as comfortable as possible, because in the first place, patients don't want to come to the clinic. So we try to make sure that you are as comfortable as possible as we do these procedures. Okay, then the procedure is intended to treat the source of dental pain and the infection, which means that our main target is to go inside the tooth where the nerve and the blood vessels are, and from there we will now do what? We will take out the infection. There are special instruments that we go with inside the tooth. Yeah, so now this is basically what happens. So to begin with, we'll numb the area that we are working with. And then from there, we use our special instruments. We have x-rays that we are able to see with, and then also we also have some endomotors and other advanced equipment. So these also advances in the treatment approaches that we use for root canal treatment aim to also make the experience very comfortable, because remember, these root canals are technique sensitive, and if it's technique sensitive, it means that we also are supposed to be prepared in terms of gadgets and also what we are using to do the root canal treatment. Okay, so the main aim is to remove the infection and not the tooth. So after we go inside the tooth, we take out the nerve and the blood vessels, and then we are supposed to wait for healing to occur, because remember I said that it's a technique sensitive procedure, and this means that it's supposed to be observed. It's different from an extraction where we just extract and then everything finishes one day. It means that after we do the root canal, we are supposed to wait for healing to occur. This healing takes about a week, so which means if we start the root canal process today, you will need to come back for review after 1 week, which means that this healing process may take place within a week. After a week, when you come back, we'll come and look at other things like, is there any sign of infection? Is there a foul smell coming from the pulp chamber? Or how is the cotton that we left there as an indicator looking? Is it showing any signs of active infection happening inside the tooth? So usually you find that these dental procedures are supposed to be done in a minimum of 2 to 3 weeks, depending on how infected the tooth is. Okay, so now after we do the first visit, which is known as extirpation or taking out the living parts, then on the second visit we continue with the cleaning and shaping, and on the third visit, which is in this case the final visit, we'll do what is known as the obturation or final covering of the root canals and eventually putting a filling. Any questions so far? I've talked about a lot of things and I'm inviting questions. For those that have just joined us, we are discussing root canal treatment and what is expected from a root canal treatment. And remember, the main objective for this root canal is to try and keep the teeth in the mouth, because remember there are teeth that we consider to be more important than the others. Okay, we have another question from Mr. Chadi. Do you give antibiotics before the procedure? Okay, yes. So depending on how the patient has presented, If there is active infection or not, that's what will determine whether we'll give the antibiotics before the procedure or not. If there is some infection but it's not severe, in some cases we tell the patient to say, no, we'll start you on prophylactic antibiotics, which means that you start before the procedure. And then if the patient has presented with severe pain, let's say an emergency root canal procedure, we'll first do the procedure and then start them on antibiotics. So which means that the first day we'll start the procedure, and then before they go home, they are supposed to go with some medication with them. So depending on the type of medication that we decide to say, oh, okay, these are the correct medication, or these are the medication that will help the patient, depending on what we find and after we assess the grade of the infection. Okay, so now we have discussed a number of things, and by now we have a basic understanding of what a root canal treatment is. And we've mentioned that a root canal treatment is basically an advanced type of a feeding. It's technique sensitive, but with the advancement of the instruments and gadgets, makes it more comfortable and much more convenient. So now, root canal or extractions, because remember, in the mouth we consider some other teeth to be more important than the others. So for teeth that we consider to be important, no matter how bad they are, we try by all means to keep them in the mouth. So now, when do we get to decide whether we'll do root canal treatment or extraction? Not every tooth can be saved, which means that depending on how bad the tooth is and its location in the mouth, if a tooth is badly damaged, even if a patient wants, so they have accepted the root canal, we have to also assess and see, is this tooth a good candidate for a root canal? Because there is also what is known as case selection, meaning that we have to select good teeth that need root canal before we even start, because it's a very technique sensitive procedure. So we want to make sure that the odds are with us before we start the root canal. So extraction may be appropriate in a tooth that is severely damaged, or we note that a tooth has what? Poor prognosis. So that's what I also tell most of my patients to say, if you hear me talking about root canal treatment to you as a treatment option, it means that I've already assessed to say, oh, okay, this tooth can be a good candidate for root canal. But if you come, I'm not even talking about the root canal, just know that, oh, okay, it's extraction, because we've assessed some of these things to say we may not succeed if we go the root canal treatment route. Okay, when a tooth can be predictably restored, preserving the natural tooth may be the appropriate option. And also, after extraction, replacement options may include the denture, bridge, or dental implant. So this means that we have to assess certain factors: the location of the tooth, how badly damaged the tooth is, can it be saved or not. Yeah. So anyway, the other thing that I want to ask the audience or the chat is, which one is cheaper between the two? Is it extraction or root canal treatment? And what is the long-term treatment for this tooth? This can also be used as a deciding factor when we are trying to decide whether to go for root canal treatment or extraction. Okay, so now we are remaining with only 6 minutes, so which means that we are supposed to address certain myths that are associated with root canal treatment. Myth number 1, root canals are always extremely painful. So as Edgar mentioned, root canal treatment is more conservative, is more on the cosmetic side of the spectrum, meaning that it's supposed to be more comfortable than an extraction, because when you look at the two procedures, with extraction we are supposed to use a lot of energy. By a lot of energy, I mean a lot of pulling, shaking back and forth. But for root canal treatment, you find that we are using most of our gadgets. So okay, there's another question from Tandiwe Piri. Doc, if I do a root canal, will the pain come back in the future? Okay, thank you for that question, madam. So when you do a root canal treatment, after the root canal, there is that healing phase. So during that healing phase, the pain should be less than the pain you were experiencing before what? Before the root canal was done. Which means that as time goes on, the pain should eventually go. And it's not supposed to come back eventually after we do a root canal. And those are some of the factors that we look at when assessing whether to go ahead and put a permanent filling and consider the root canal to be finished. Okay, we have another answer to the question from Mr. Charlie. Extraction is cheaper, but RCT is the best treatment option. Yes, I agree with Mr. Charlie here. And when you look at some of these things, when it comes to these dental procedures, I lean more, personally, I'm more a conservationist, if there is such English. I lean more towards preserving the natural teeth. So which means that even if root canal, even if extraction is cheaper, but in the long run, it's more costly. Because when we take out a tooth, it means that that tooth will never come back. It also means that that tooth may become more costly to replace. Because imagine we just take out one tooth, we need to put back that tooth as soon as possible, depending on what? On the location of that tooth. Every time we take out that tooth, you find that we are reducing the efficiency of the system. This means that when you take out one tooth, the teeth that remain do a lot of work. And when there is a lot of work being done by the teeth, it means that those teeth become overwhelmed. Eventually, other complications may come in. The teeth that remain try to close the gap, they move towards the gap, they are leaving their anatomical locations, thereby making them more vulnerable. If the tooth stops hurting, the infection has gone. That's myth number 2. And I can clearly disband that myth or bust that myth to say, if the pain stops, it doesn't mean that the infection is gone. It means that the body is trying to fight off that infection, and even if there is no pain, the infection may still be there, and when it comes back, when the pain comes back, the infection may have even spread and become more severe. Okay, myth number 3, it's always better to remove the tooth. I've already talked about that. In the long run, you find that removing a tooth may even be more expensive, because if we take out one tooth, just putting back that tooth is usually costly. Okay, myth number 4. Once you've had a root canal, you never need to worry about the tooth again. So now, when we do root canal treatment, we don't have to end there. We should understand that root canal treatment relieves you of pain, but we are supposed to do some follow-up treatments, which means that after we do root canal, the tooth becomes it's a dead tooth. It's no longer producing pain, but it will still need a crown on top. What is a crown? A crown is simply a cover or a cap that we put on top of this tooth so that it becomes stronger. When you are chewing, those forces do not go directly on the tooth. It reduces the amount of force, because remember, when we are chewing, we produce a lot of force. That's why we are able to do what? We are able to crush bones and other things like that. Okay, so now as we end this live session, I would like to throw in a number of questions. How many visits does a root canal take? We've discussed 2 or 3. Can a root canal fail? Yes, in some cases it may fail, and these things are supposed to be assessed before we even start the root canal. That's why I was saying that case selection is very important. We're supposed to see what are some of the red flags before we go into this root canal. Can I eat after a root canal? Oh, of course you can eat. That's why we are saving that tooth. Does every root canal treated tooth need a crown? That's what we usually advise. If you do a root canal, follow it up with a crown so that the tooth is more stronger and less vulnerable to fractures. What happens if I leave an infected tooth untreated? The infection spreads and it may result in other complications. Okay, so things to remember from this live session. Severe toothache does not automatically mean the tooth has to be removed. That is very important. Root canal treatment can help preserve the natural teeth when clinically appropriate. Don't wait for any bearable pain before visiting the dentist. You need to visit the dentist every 6 months so that at least we check where their problem is and what treatment options we can offer you. That way the treatment the prognosis may become much better. Okay, we have another question. Is it a question or okay. The tooth you perform the root canal, can it get caries from the neighboring teeth? Yes, so that is true. You find that when a root canal is done, there are other neighboring teeth. The tooth can still be reinfected. And that's why when we do root canal, we try by all means to make sure that if there are any teeth that are looking suspicious, we treat them as well so that they do not share the infection or the infection does not spread. Okay, thank you very much once more for attending this live session. We'll be having these live sessions every Sundays on 18 hours. If there is any other question, you can type in the chat or get in touch with us. If you feel there is anything that we need to come and discuss further, you can get in touch with us on 0772 393989. That is 0772 393989. Or you can also go through our website. See, there are some frequently asked questions there and other things may be addressed from there, which is the website is trenddentalclinic.com. That is trenddentalclinic.com. Thank you very much once more and have a good night.